Hello again. Today I will explain hopefully the lung volumes. What do we want to know about the lung volumes, or what do we need to know? First, let's talk about the most basic lung volume, that is the tidal volume. Why is it called tidal volume? Because it's tidal, looks like a tide. This tidal volume is the volume that you use to breathe when you are relaxed, when you are calm, not the one that you use when you are running away from and the dog's chasing you, or when you are jumping up and down. It's about between 0.4 and 0.5 liters. In other words, 500 milliliters. The other volume is the one that you can is the maximum amount of air that you can breathe in. It is called the inspiratory reserve volume. The other volume, and of course you're probably thinking about it already, is the expiratory reserve volume. What are the values for these? Well, the value for the inspiratory reserve volume is between 1.9 and 2.5 liters. For the expiratory reserve volume, it's about, say, 1.1 and 1.5 liters. Now, there's another volume that you need to know. That is the reserve volume. What is the reserve volume? The reserve volume is the amount of air that you do not breathe out. It is changed, but you've got this volume always maintained, even when you breathe out everything that you've got. And the reserve volume, residual volume, is the residual volume. Residual volume, RV, is about 1.5 to 1.9 liters. And so, these are the volumes. Yes, these are the volumes. What about the capacities? What's a capacity? A capacity is a sum of volumes. Take, for instance, the inspiratory reserve volume. Inspiratory reserve volume includes both the tidal volume and the inspiratory reserve volume. This is the inspiratory capacity, and it's got a value between 2.3 and 3 liters. Another one would be the functional residual volume. Functional residual volume includes the expiratory and reserve volume and has a value of about, say, 2.6 to 3.4. 2.6 to 3.4 liters. Let's throw up another capacity. Functional residual capacity. Another capacity would be the total lung capacity. Total lung capacity includes all three: tidal, inspiratory, and expiratory reserve volumes. It is known as the vital capacity. The vital capacity. The vital capacity is about between 3.4 and about 4.5 liters. This is the vital capacity. Alright, that's the vital capacity, yes. Another capacity that I'd like to mention would be the total lung capacity. This includes everything, even the residual capacity. This is the total lung capacity, or TOC, and it's between 4.9 and 6.4 4.9 and 6.4 liters. Alright, these are the lung volumes and lung capacities. Now, there's something we need to know about the residual volume, that the residual volume does not get exhaled, except if you've got a pneumothorax, for instance. So this volume is, so breathing, gas exchange, it is taking place continuously. It's not just you breathe in, get air, gas exchange takes place, you don't breathe in, there's no gas exchange. It does take place continuously. Alright, so for us to understand what is an obstructive and restrictive disease, first we must understand an important concept that is known as the flow rate. What is the flow rate? Well, a flow rate is the amount of air that you can breathe in a quantity of liters in time known as second. This is the flow rate. And you can use this for two purposes. You can use it not for two purposes. You can use it in order to determine basically two diseases, which are the only ones as far as I can tell, currently respiratory ones. These are the restrictive or obstructive diseases, whether you've got an obstructive or restrictive disease. And you can obtain this using either a spirogram or using a flow volume loop. Alright, so now you're wondering what is a flow volume loop and what's a spirogram. Let's first talk about the spirogram. The spirogram is a representation of volume to time. The volume is in liters, the time is in seconds. So you're just breathing on, breathing on, breathing on. You take in a deep breath and then you just let it go. Now, this is the volume. You've accumulated a volume here. Now when you start to breathe out, and this is the most important part that we are concerned with, you get a certain value at this slope. This is not really the best accurate drawing, but should get us through this tutorial. This one is known as FEF, forced expiratory flow, and the FEF is about FEF 25 to 75%. This is the amount, the percentage of forced expiratory flow, and this is used at low lung volumes because there is no consumption of effort. It is effort independent. There's no energy being used, and so you can detect a mild peripheral obstruction or an obstruction in the airways, small airways that can't be detected when you have a forced expiratory flow. This is within the beginning of the forced expiratory volume. What is the forced expiratory volume? Well, basically the forced expiratory volume, FV1, is the forced expiratory volume within the first second. And you can use this one. It is simply the forced expiratory volume. So it is a volume, right? Use this volume in order to determine the airflow. The airflow, when it just passes through the pathways, respiratory pathways, might increase or decrease. If it decreases, if there's a change in it, then you know you've got an obstruction. If there's a decrease in this forced expiratory volume. If it is that, the law says that if it is lesser than about 70%, you've got an obstruction. So if it is lesser than 70%, you've got an obstruction. What about FVC, forced vital capacity? You can use the forced vital capacity. It's a capacity eventually. We've already discussed this one. It's the vital capacity in a forced expiration, and this forced vital capacity VC is used in coordination together with the FEV1, this one, as a ratio, FEV1 to VVC. You use this ratio, and if you've got this ratio, say less than 70%, then you've got an obstruction. It's also a sign of an obstruction, like the FEV1. The thing about restriction, on the other hand, obstruction is just simply something that does not allow airflow to just pass by, like we said here. As for restriction, the respiration is not reducing its maximum capacity. We're not reaching the maximum ability, and so what happens is that you will have less air going through. You will have less air going through here. You will have a decreased volume. If you had decreased airflow there, you will have a decreased volume here. Keep this in mind, because this is the principle, the concept. And so an indicator, and a very important indicator of the restrictive, is the total lung capacity. If you've got a decrease in the total lung capacity, say lesser than about 80%, then this is a sure sign of a restriction. In other words, it's a low compliance. The restriction. You're not getting as much volume as you must, and so this is a restriction. You've got less than 80% total lung capacity. Also, it is important to keep in mind that all the other, because it is a decrease in the lung volume and not the airflow, we've got all the other values, including the residual, the reserve volume, the forced expiratory volume, but you won't have the ratio decrease, not the ratio. The ratio is only for obstructive. By combining these parameters, you will know if you've got an obstruction and a restriction, or just simply a restriction, or just simply an obstruction. And so this is mostly the important part, and this is the practical part and the interpretation of a pulmonary functional test. Thank you for your attention. I hope you gained at least the least of knowledge that you can. Cheers, see you next time.